everyone, today we are interviewing Dr. Hector Garcia Moreno, who works at UCL and is one of the lead neurologists working on the DRPLA natural history and biomarkers study. Hi Hector.
Hello Silvia, good morning.
Can you introduce yourself? What's your background? What do you do?
Yeah, thank you. First of all, thank you for having me this morning. So first of all, my name is Hector Garcia. I'm a neurologist and clinical research fellow, and I work at the Ataxia Center, the London Ataxia Center, in Professor Junti's team. I started working here roughly 6 years ago, and since then I've been taking part in different research, clinical research projects, mainly natural history studies in different forms of genetic ataxias. So for instance, Friedreich's ataxia with the EFAT study, different types of spinocerebellar ataxias or SCAS with the EuroSCAS study, SMI study, and recently we started working in DRPLA with our DRPLA natural history biomarker study.
So Hector, can you tell us a bit about what DRPLA is?
Sure. So DRPLA stands for dentatorubral pallidoluysian atrophy, and it's a type of genetic ataxia. Although we don't call it a SCA, it shares quite some features with other spinocerebellar ataxias. DRPLA is due to a mutation in a gene called atrophin-1, and we know that it's a CAG expansion, which basically means that a certain part of the gene is longer than it should be. And DRPLA is a type of slowly progressive ataxia, a little bit different when it starts in children compared to adults. Normally children, they have the ataxia, epilepsy, myoclonus, and some learning disabilities. And when the condition starts in adulthood, normally people present with the ataxia, chorea, which means like fidgety movements, also cognitive impairment, and also they can display some what we call neuropsychiatric symptoms on depression, anxiety, and so on.
So can you tell us a bit more about how DRPLA is managed?
Yes, sure. So in DRPLA, as in different types of genetic ataxias, we don't have a curative treatment, which means that we can't get rid of the condition. However, we rely on what we call symptomatic treatment, which means treating the different problems that a person with the condition tells us. So we can normally refer the patient to the physiotherapist, the occupational therapist, speech and language therapist, and then we have different drugs to treat symptoms like cramps, bladder problems, pain, etc.
Perfect. And how would that be important for a future clinical trial? So at the moment there are no clinical trials for the DRPLA, but this is what we are all aiming for, right? So why is it important that we are doing this project now, keeping in mind our future goals?
Yes. That's a very good question, actually. So, as you said, we don't have any treatment now, and the way to get new treatments is through clinical trials. To do a clinical trial in a condition, it's very important to have quite a lot of information about that particular condition beforehand. Because, for instance, you need to know how the condition naturally evolves, what we call the natural history. And also in a clinical trial, what is very, very important, it's fundamental, is to choose an outcome measure, something that we can measure to quantify if the new treatment is working or not. And something that is very useful as outcome measures is what we call biomarkers. Biomarkers are simply characteristics in someone that we can measure. We can use as biomarkers height, weight, or something, or some other biomarkers more complex, like things that we can measure in blood, on other fluids, or even the MRI. Okay, so this project, one of the main aims is to prepare things for a future clinical trial. So for instance, we are going to follow up the participants to know which signs and symptoms are part of the DRPLA picture and how they evolve over time. And then we are going to perform different assessments, clinical, through different samples that we are collecting, MRI, to characterize different biomarkers that we can use in the future as we were talking these outcome measures in a clinical trial.
Perfect. So it's a way of collecting information about the condition, and as you mentioned, it involves clinical assessments, but it can also involve collection of biomaterials. And at the end of the day, what all the investigators are trying to do is just describe this condition over time and find things that are measurable. So in the future, in a clinical trial, you can see if a treatment can change the course of the condition, right?
Yeah, exactly. And I would like also to point out that these type of studies that we are doing, these natural history or observational studies, they are very, very important. I perfectly understand that in genetic ataxias we are running against time, because obviously people who are affected, they need a solution now, right? But we need to acquire all this information before we can successfully enter a clinical trial, because not having enough information or not having good biomarkers can affect the design of those clinical trials, and it could be a reason for failure of those studies.
Thanks, Hector.
So thank you for having us here, Silvia. My name is Ola, and I'm a research assistant working on this project. Previously, I studied psychology, and then I transitioned to studying and working in clinical neuroscience. And I joined this team about 5 months ago, so now I'm working with Hector in the Ataxia Center, working on DRPLA research as well as other types of genetic ataxias.
So we have been talking a lot about what's this study and what are the objectives, but let's talk about who can actually participate.
So we're looking for participants of any age who carry the mutation that causes DRPLA, but also we're looking for participants who don't have DRPLA to act as controls. So this can be a spouse or a family member, and this will allow us to compare how people with DRPLA differ from those without.
So you are looking for individuals with DRPLA, but also some of their family members or spouses, even friends.
Exactly, yeah.
And then it's important that these control subjects do not have other types of ataxia.
That's right.
So for those that are interested in participating, let's talk about how frequent these study visits might be.
So it's a 2-day consultation that takes place once a year, and it continues over the course of 3 years. And we do cover costs if you are needing to travel into London, and if you need to stay the night, then we'll cover the cost of the accommodation as well.
Perfect. So it's 1 visit per year, and
Exactly.
the total is 3 visits.
That's right.
Okay, so in these yearly study visits, what do you do? What do participants have to prepare for?
So we carry out several different types of assessments. This will include information about your genetics, your general health and your clinical history, as well as physical examinations, functional assessments and tests of your cognitive function. And also we hope to take biosamples, which includes blood, urine, stool, saliva, and MRI. Although we encourage participants to do as much as they can, if there's something that you don't feel comfortable doing, such as the MRI, then we can discuss this on an individual basis.
So it's important for people to keep in mind that they should not feel any pressure to do everything, and all the study procedures will be explained to them in detail. The study staff will also answer any questions that you have. So what's the best way for any people that want to participate or they are a bit unsure and they just want to find out more about the study?
Definitely. So if you are interested in participating in the study, please reach out to us via email, and we will set up an initial phone call or a Zoom call to kind of go over all the details of the study and answer any questions that you may have or any concerns that you might have about the procedures.
So now that we understand what the project is about and what the study visits involve, let's go back to something that we discussed earlier on. So how do these procedures that are performed at the study visits link with the study objectives and also with the goal of informing future clinical trials?
So all the clinical assessments that we will carry out will help us to inform the clinical history of the disease, which is to say how it evolves over time. And additionally, the information that we can derive from the biosamples, like the blood and the urine and the MRI, will hopefully give us information about important biomarkers in DRPLA. And these will then hopefully be the basis of future clinical trials where we can use them either as diagnostic tools or as a surrogate outcome measure of a clinical trial.
Thank you.